7. Silent signs. Your kidneys are failing. Number 4. Appears on your skin. Most people miss these signals until the problem has already progressed, and many of the everyday foods, additives, and over-the-counter meds you reach for can quietly increase kidney workload. Stay with me. I'll walk you through each sign, what's likely happening under the surface, and one practical way those lifestyle factors plug into the risk. If this is hitting home, and you want more health alert videos like this, hit subscribe and the bell now. Your kidneys filter about a cup of blood every minute. They balance fluids, clear waste, help control blood pressure, and support red blood cell production. Because they work silently and reserve function, damage can build without pain. Things like sodium-heavy processed foods, phosphate additives, sugary drinks rich in fructose, chronic NSAID use, excessive alcohol, and certain concentrated nutrients can increase that workload. That doesn't mean a single meal will break your kidneys, but over months and years these pressures add up, and the body will start to show subtle, often overlooked signs. Watch for patterns, not single episodes, and remember these signs are clues that deserve medical evaluation, not instant diagnoses. Sign 1. Swelling or edema. Puffiness around the ankles, feet, hands, or face. You may wake up with puffy eyes or notice your shoes feel tighter by evening. This happens because the kidneys aren't removing excess sodium and fluid as efficiently. Sodium holds water, and reduced filtration lets fluid collect in tissues. Chronic high sodium intake, common in processed and convenience foods, plus drugs that alter blood flow to the kidneys, like frequent NSAID use, can make this worse. If swelling is persistent or asymmetric, one leg more swollen than the other, get it checked, because while swelling can come from many causes, consistent edema can be a sign of declining kidney function and deserves evaluation. Sign 2. Changes in your urine. Foamy-looking urine, consistently dark urine, blood in the urine, or persistent changes in volume. Foamy urine can be a visual clue to proteinuria, protein leaking through damaged filtering units, the glomeruli, into the urine. Dark or tea-colored urine and visible blood may indicate bleeding in the urinary tract or damage to filtration structures. Certain dietary and chemical exposures, heavy phosphate loads from additives, persistent high blood pressure from salty diets, and some medications can stress those filtering membranes over time. If you notice new, ongoing changes in your urine, a simple urine dipstick and a chat with your clinician can clarify whether protein or blood is present. These tests are basic but important screens and are not a substitute for a full medical assessment. Sign 3. High or hard to control blood pressure. Your number on the cuff keeps creeping up, or medications that used to work now don't. Kidneys help regulate blood pressure by controlling fluid balance and hormone signals. When they're strained, blood pressure often rises. Diets high in sodium and foods loaded with phosphate additives can worsen vascular stiffness and make pressure harder to manage. And chronic use of certain painkillers can blunt kidney blood flow and raise pressure as well. High blood pressure can both damage the kidneys and be a result of that damage, so persistent hypertension warrants testing of kidney function even if you feel fine. Sign 4. Skin changes. Persistent dryness, intense itchiness, unusual discoloration, rashes that won't improve, easy bruising, or slow-healing sores. This is the one many people dismiss as just dry skin, but in the context of other subtle signs it matters. When the kidneys fail to clear metabolic waste and maintain mineral balance, toxins and mineral imbalances can accumulate and affect the skin. You may see a dull, sallow complexion, scratchy patches that seem allergic but don't respond to creams, patches that bruise easily, or cuts that heal slowly. Mineral imbalances, especially involving calcium and phosphate, and toxin buildup are common explanations, and even small chronic exposures to certain additives or alcohol can magnify the effect. If your skin changes are persistent, severe, or different from your usual eczema or dry skin pattern, mention them to your clinician. They can be a visible sign of declining kidney clearance, but are not diagnostic on their own. Sign 5. Persistent fatigue, low energy, and brain fog. You're exhausted even after a full night's sleep. Focus is poor, and simple tasks feel heavier. Kidneys produce hormones that support red blood cell production. When function drops, fewer red blood cells may circulate and your tissues get less oxygen, a slow-burning anemia that causes deep fatigue. At the same time, toxin accumulation and metabolic imbalances interfere with cellular energy. Diets high in fructose and frequent alcohol intake can worsen metabolic stress and raise uric acid, adding another layer of burden. If your tiredness is new, ongoing, and not explained by sleep, mood, or activity changes, it's a reasonable reason to check kidney-related labs alongside other routine tests. Sign 6. Nausea, decreased appetite, metallic taste in the mouth, or persistent indigestion. Food suddenly tastes off, or you feel mildly nauseated after eating. These are classic, if subtle, symptoms of accumulating waste products that the kidneys usually clear. When those compounds rise, they can alter taste and trigger nausea even without an obvious gastrointestinal cause. Certain dietary patterns, very high-protein diets, or regular consumption of processed meats and alcohol can increase metabolic byproducts that add to the workload. If you notice sustained appetite loss, a metallic taste, or new-onset nausea without another clear cause, it's worth discussing with your healthcare provider, because these complaints can reflect declining clearance of metabolic wastes. Sign 7. Changes in urination pattern and nighttime trips to the bathroom, going more often at night, nocturia, suddenly waking up to urinate, foamy or reduced urine volume, or new urinary urgency. The kidney's ability to concentrate urine and manage fluid balance can change as function declines, leading to more frequent urination at night or a sense of urgency during the day. Cramping and intermittent pain can also show up when small stones or crystal deposits form. Diets high in fructose can increase uric acid and promote crystal formation in predisposed people, and excessive intake of oxalate-rich foods combined with dehydration can raise stone risk for some. These changes are often subtle at first, a few more bathroom trips than usual, but persistent shifts deserve testing. Remember, a single episode isn't proof of chronic kidney disease, but a recurring pattern should prompt evaluation. Across all 7 signs, one pattern stands out: silent accumulation. Sodium, phosphate additives, sugary beverages high in fructose, chronic overuse of NSAIDs, heavy alcohol use, and a diet dominated by ultra-processed foods can gradually increase the chemical and hemodynamic burden on your kidneys. That doesn't mean every person who eats a salty snack will lose kidney function, but in aggregate these factors can push vulnerable kidneys over time. Think of your kidneys like a filter that can handle a lot, but not infinite abuse. Small, repeated insults add up. What should you do if you recognize one or more of these signs? First, don't panic. None of these symptoms alone proves kidney failure. Second, schedule a basic medical check. Ask your clinician about a urine dipstick to look for protein or blood, and a blood test that includes creatinine to estimate glomerular filtration rate, eGFR. These are routine screening tools that can detect early problems or reassure you that another cause is responsible. If tests are abnormal, your clinician may recommend follow-up testing or a referral, but initial screening is straightforward and widely available. Prevention notes and practical habits that reduce kidney burden. Cut back on ultra-processed and sodium-heavy foods. Limit sugary drinks high in fructose. Avoid chronic, unsupervised use of NSAIDs. Be cautious with excessive alcohol, and be mindful of extreme diets that concentrate oxalates or other minerals. Small changes: drinking enough water most days, choosing whole foods, and using pain relievers judiciously under medical advice can lower chronic stress on the kidneys. These are general suggestions, not individualized medical advice, and some people will need tailored guidance based on their health history. A few additional things to bear in mind. If you have diabetes, high blood pressure, a family history of kidney disease, or are taking medications that affect renal function, you're at higher risk and should maintain regular checkups. Athletic supplements, very high-protein regimens, and frequent use of certain over-the-counter remedies can add strain in specific contexts. And while skin creams or topical therapies may relieve dryness or itching, persistent skin changes that don't respond to simple measures deserve a medical look because they could reflect internal changes rather than isolated dermatologic conditions. To recap quickly, watch for these 7 silent signs: swelling, urine changes, rising blood pressure, skin changes. Remember number 4, itchiness, discoloration or slow-healing sores, fatigue and brain fog, nausea or metallic taste, and persistent shifts in urination pattern. Each of these can be linked, plausibly, to how your kidneys handle fluids, minerals, and waste. Each sign should be taken seriously as a cue to investigate, not as a definitive diagnosis. If you noticed one of these signs, consider getting a basic urine and blood test, and watch our video on foods that stress your kidneys for practical steps you can take today. Early detection gives you options. Simple lifestyle changes and medical monitoring can slow progression when problems are caught early. Take care of these silent workers inside you, and reach out to a clinician if something here feels familiar.